people were saying was getting in the way.
Well, I'd like to thank you for inviting me here, even if it was only on Tuesday. Your almost Dr. Duggar over here called me up and said we're dying. There's no surgeon wants to come up here to talk. I thought that was relatively appropriate. So I looked at the rules here, and it says I have to be respectful of the other contestants, so I will try to be respectful. But one of the things I did...
But I can't.
That's right. One of the things that I did was I tried not to take too many notes, because I think that at this point in your lives, you've seen enough notes and enough paper, and you've had to learn enough. So this is all basically from the heart. Now, I've been in practice over 30 years, which I'm really having trouble dealing with. Because people keep asking me, well, I'm going to retire, and I said, I think when I'm dead. But one of the things that has happened to me over the years is I like what I do. So let me tell you a little something about myself, and we're going to look at this from a slightly different approach. I mean, both of our prior people have had me crying, and I'm almost ready to change and become a psychiatrist. But then again, wasn't it just last year that I was watching TV and there was Lisa Kudrow on web therapy? What do we need psychiatrists for? You know? You just send her a credit card, you're on the web, boom, take care of the whole thing. So anyway, and then pediatrics. I mean, pediatrics is great. I mean, what would we do with dead children? You don't want that. So, but the most important thing with pediatrics is immunize. And this is just something that you all got to learn. I mean, the lifespan of kids has, I don't know, doubled, tripled, quadrupled, whatever. I mean, obviously they do far more than that. But that's one of the things that's happened over time. I mean, I'm reading this book, Game of Thrones. I think about half of the kids that are born die because none of them are immunized. Well, also there are no doctors, but that's only a minor factor in that. So, what did I do with my life? Well, after graduating medical school, I started in surgery, and I went into ENT. So I spent a year doing general surgery. Then I spent 3 years doing ENT training. And while I was in ENT, which I loved, and it's a great field, you treat both sexes, all ages, and I would have stayed in it, except I was sick all the time. I mean, kids, they sneezed on me, and I didn't even have my own at the time, and I kept coming home all the time with a runny nose. I thought that was crazy. I mean, I hadn't had strep throat since I was 8. The first time I started in ENT, about 2 months in, I developed strep throat. So, you know, you never know. Sometimes you get what your patients have. I sort of stayed away from head and neck cancer, though. That was one of the areas I tried to avoid. And then after finishing ENT and deciding I didn't want to do that, life was different back in those days. You didn't have to apply for your final residency 17 years in advance. I went into plastic surgery, and I spent 2 years training in that and took my boards in both ENT and plastics, and I've been doing that for the past 30 years. So one of the things that you all have to look at over the next few years is what you want to do with your life. Now, when you're a first-year student, you know you don't want to stay in the classroom forever. And obviously, at the end of your second year, you're sure of that. Then, over the next 2 years, you do have a chance to rotate through various different specialties, and you get to see how they work and what the hours are. Now, I would probably be about the umpteenth person who's told you that the hours today are totally different than they were when I trained. And in some respects, they're better, and in some respects, they're worse. Because I could work for a month and have 3 weekends off. Of course, because on one of those weekends I went into the hospital on Friday morning and I went home Monday night. But I got 3 weekends off after that. You don't have that pleasure anymore. So what I'm going to tell you is that surgery and surgical specialties, from my point of view, are the way to go and the residencies to save. Why? Well, we haven't heard from our internist yet, and I'm sure we will, and give us a really good understanding of what it's like to be an internist. But a really good surgeon knows medicine. I know that when I send a patient out for medical clearance, they're going to get it. They can be half dead, and the internist clears them, because they don't really care, because they're not in the hospital and it's irrelevant. So you got to really understand what's going on with all the medications that your patients are taking and what the reactions are. Down in Manhattan, a couple of years ago, a woman decided she wanted a facelift, and her husband was a physician, and she had myasthenia gravis. And medically cleared, went in and died. So, you have to know what the side effects are of medications and drugs and things like that, and know who to trust. So a really good surgeon understands what internal medicine is involved. If you don't want to go as far as plastic surgery, as I said before, ENT is terrific. You treat all ages, both sexes, and you take care of everything. Kids with colds. One of my favorite kids, the kid came in one time, he said, "What's the matter?" I said, "I have a fire truck in my nose." And he did. He'd taken this little fire truck and shoved it in his nose. And so we're trying to talk, try to decongest his nose so you can see it, and numb it so you can get it out. And the kid was just being totally uncooperative. I didn't want to put this kid under general anesthesia. We used to send the parents downstairs and tell them to go get some drugs, bring it up, we give it to the kid, and the kid go to sleep, and we take it out. As soon as the parents left to go to the drugstore downstairs, the kid looked at me and says, "Okay, you can take it out now." And took it out, and that was it. So, kids are great, and I enjoyed taking care of them. Now, in plastic surgery, I still take care of both sexes and all ages. And again, as I started to say before, when you decide what you say, look at your lifestyle. What kind of a lifestyle do you want? You want to be up all night? Dr. Haynes is wonderful. I love this man. He's terrific. He's delivered more babies, and probably about 3/4 of them are during the middle of the night. He's got a wonderful wife. She sees him on occasion. Is this what you want with your life? I love plastic surgery. You can schedule almost everything. We're doctors. When a doctor has a problem in my hospital, although they hate us, they call us. And what doctors are these? The internists. The patients have decubiti. You roll them over, look at their back, and go, "What the hell's that?" We get called because we got to fix it. You have the cardiac surgeons who do this wonderful job, and then the chest falls apart. You think they fix it? No. They call us. So although we get some of these horrendomas, or the vascular surgeons that put a graft in and then the skin doesn't take and the wound opens up, and we get called to close that. But again, oftentimes, you schedule it during the day. You don't have to do it at night. And then you have the privilege of, remember what we heard before about reimbursement? I don't deal with reimbursement. The vast majority of stuff I do is self-pay. You want it, you pay for it. And it works out just fine. The world wants to be better looking. So, in plastic surgery, that's what we do for them. Sometimes they don't come out better looking, but that's why we have malpractice insurance. But anyway, just remember, you are there to help your patients. And the goal is you don't want to make them worse, you really do want to make them better. But also, at the end of the day, you want to be able to go home to your family, and you want to be able to have a life. And, again, I've been doing this for a long time, and people say, "Well, aren't you burned out?" I go, "No, because I like what I do." So, that's the main thing, to look at people in the various different specialties and ask them if they like what they do. You brought up the thing about pediatricians being Surgeon General. Well, fine, they don't like doing pediatrics, so they became a Surgeon General. So, anyway, what I think you have to look at is what do you want to...
Surgeon.
I'm
So you want
sorry.
to be called surgeon.
Right. Yes, yes, right. Well, what do you want to do with the rest of your life? And how do you want it to be? So when you go into your specialty, think about that. And I found plastic surgery to be fabulous. ENT would have been great. Surgery, maybe not quite so, but you had to do the surgery. So you have to save surgery if you want to go into a surgical specialty. Thank you. Enjoy.